You all settled there, Mr. Carter? The chair recognizes the gentleman from Georgia, Mr. Carter, for 5 minutes of questions.
Thank you, Madam Chair, and thank both of you for being here, and thank you for your indulgence. You know, this is extremely important. We all understand that, and no one understands it and appreciates it more than you do, and I just want you to know we are very thankful for your service. We all know, I'm a healthcare professional myself, I'm a pharmacist, so we all know that the healthcare workforce has suffered major losses as a result of staffing over the course of this pandemic. And we all know that they've done yeoman's work. They have truly been our heroes, and we appreciate them very much. But the situation has affected every state and every corner of the nation. No one's been immune from this. It's challenged health providers' ability to care for their patients in dire need of life-saving healthcare treatment. Ms. Johnson, in your written testimony, you highlighted over 12 workforce development programs that are focused on increasing the number of healthcare professionals trained in behavioral health, mental health, and substance use dependence. Describe what measures, if you will, are used to determine the effectiveness of these programs and provide your overall assessment of it and if these programs are meeting their mission.
Thank you, Congressman, for the question and for your attention to the critical workforce needs. We assess the number of individuals trained, and then we track over time to see that those individuals, our goal is often to ensure, for many of our programs by statute, to ensure that individuals practice in underserved communities that we identify by assessing what capacity looks like on the ground in communities across the country. And so we also measure practice over time where individuals who we train are practicing. And so what we see, in particular, a program like the National Health Service Corps, which is our loan repayment and scholarship program, where individuals, we offer a loan repayment and scholarship in return for individuals practicing in high-need communities. Our data continuously suggests that people tend to stay in those communities even beyond their service commitment. So we have seen real success with programs like that. I think that one of our challenges is just ensuring that we have the resources to continue to recruit people into the mental health and substance use disorder pipeline, and that we have the mental health and substance use disorder workforce that can be preceptors that can help make sure that people can do their clinical practice as part of the training. Understood.
But let me ask you, because we know that nothing's perfect, if the programs are not effective or they're not sufficient, what other measures does HRSA implemented or would you implement to address the extreme lack of behavioral health providers in particular?
Well, so one of the things that we have done is really look at all of our programs to figure out where there are opportunities to address mental health and mental health and substance use disorder needs. And so, you know, over the years, programs have been expanded to allow for mental health and substance use disorder providers to be part of them, or we've taken programs like some of our primary care training programs and added mental health and substance use disorder to the curricula so that we can expand access to these services and capacity.
Good. Thank you very much for those responses. Dr. Delphin-Rittman, let me ask you, I want to touch on the impact that the pandemic has had on the mental well-being of our kids. I'm a grandfather. I've got 6 grandchildren, and it's very important to me. 3 of them are school-aged, and I know it's had a mental impact on them. You know, it's been 2 years since we came to a halt due to COVID-19, but there's a lot that we know about the pandemic now that we didn't know before. In fact, the Surgeon General has stated that the effect of lockdowns is devastating on young people's mental health. What's being done? What's being done to ensure that we address the mental health issues and substance abuse disorders that resulted from mandated school closures?
So in terms of the services and programs that are in place to address the mental health challenges that we're seeing, you know, among students, you know, there are programs like Project Aware. So Project Aware, again, is a school-based program that helps to identify children that may be struggling and connect them with services and supports. We know that even before the pandemic, research and data showed that children were struggling. Certainly, we saw an increase during the pandemic. During the pandemic, we did increase and expand the Project Aware programming. Also programs like mental health awareness training, to be able to train individuals to be able to identify students that are struggling or community members that are struggling, and ultimately connect them to services and supports.
Good. Well, thank you both again for your work. This is extremely important, and we appreciate all your efforts. Thank you, Madam Chair. Now yield back.